are you?
Good. I'll be doing your cleaning today, and we're just going to go over your medical history, okay?
Okay.
Have you had a history of seizures before?
Yes.
Yes? Okay. And how often do you get seizures?
Not very often, maybe 3 or 4 times a year.
Okay. And when was your last one?
Maybe about 6 weeks ago.
Okay. And how long do they usually last for you?
No longer than 5 minutes.
Okay. And have you ever been hospitalized
No,
for that?
ma'am.
No?
Mm-mm.
Okay.
It's important to never treat a stranger. Updating a current medical history prevents any emergencies happening during the dental appointment.
Okay, you ready?
I think so.
Okay. Can you open for me?
Can you hold that book up for me so I can see it? That one.
Are you feeling okay?
I'm feeling okay.
Okay.
Our patient is currently experiencing the prodromal phase of a tonic-clonic seizure. This is marked by emotional reactivity, including increase in anxiety or depression. She may also exhibit an immediate sign of the appearance of an aura. The aura is not really a warning sign. Instead, it is an actual part of the seizure. Most epileptic patients exhibit the same recurrent aura before each episode. The aura usually lasts only a few seconds, and its clinical manifestations relate to the specific area of the brain in which the seizure originates. The aura itself, which may be olfactory, visual, gustatory, or auditory in nature, may be considered a simple partial seizure that progresses to a tonic-clonic seizure. Now she's in the pre-ictal phase. The individual loses consciousness. Now she's experiencing myoclonic jerks. She has an increase in heart rate and blood pressure up to twice the baseline value. She's in the ictal phase, and where the tonic-clonic components occur, where skeletal muscle contractions and relaxations occur, accompanied by heavy stertorous breathing, dyspnea, and cyanosis. The most important thing in this phase is to maintain her airway and prevent her from injuring herself. The patient's now in the post-ictal phase, where her consciousness will gradually return and urinary or fecal incontinence may occur. Full recovery of pre-seizure cerebral functioning takes approximately 2 hours.
You okay, Erica? You just had a seizure, so you're okay now, okay? We're just going to call out your sister in, and she's going to take care of you.
This is your sister. This here.
Are you okay? What's happening? She just had a seizure event, but she's fine now. She's just going to rest a little bit. I'll sit her up for a little bit, and you can...
Okay, do we need to stay here until she
Until she
feels
feels
better?
okay. Yes.
Okay.
Yes, you're welcome to stay here.
Are you okay, Erica?
Just to recap, in the management of a tonic-clonic seizure, the first thing to do is recognize that the seizure is occurring, discontinue dental treatment, then activate your office emergency team. If the patient is unconscious, position the patient in a supine position with feet elevated. Consider activating emergency medical services. Make sure the patient's airway is open and that their breathing and circulation is working. If they're in the post-ictal phase, position the patient in supine position with feet elevated. Continue to make sure that their airway is open and that they're breathing. You can administer oxygen, monitor vital signs, reassure the patient, and permit recovery, and then discharge according to their status.